The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh, and today we're going to be talking about diabetes. Do you have diabetes? Does someone you know have diabetes? It's a huge crisis in this country and around the world. It's increasing. And our specialist today, the person we're talking with, is Dr. Tim Arnott. And really you're a specialist in family medicine and also lifestyle medicine, but you see a lot of diabetics at the Lifestyle Center of America. Is that correct?
We see well over 40% of our patients with diabetes.
Now, what exactly is diabetes and what kind of a problem is it in our country and around the world?
Well, basically, diabetes is having too much sugar inside your blood. That's the basic problem. We need sugar, but when you have too much of it, it causes a lot of problems. Now, there are two basic types of diabetes. See, in order to get the sugar inside the cells, you need insulin. So in type 1 diabetes, these individuals, usually young individuals, completely lose their ability to make insulin. In other words, that organ in the body, the pancreas, that makes the insulin is completely knocked out, and they're not able to make any insulin.
So that's type 1?
That's type 1.
Okay.
But that's a minority of the individuals with diabetes. Only about 5% of those with diabetes have type 1 diabetes.
Okay.
Over 95% have type 2 diabetes. Now, it's typically been called adult onset diabetes in the past, but now we see type 2 diabetes showing up in younger and younger individuals, even in elementary school.
Is that right? Do you see people that young at the Lifestyle Center?
Not usually. Usually people come to us when they're starting to have side effects, problems, and real serious situations. But in type 2 diabetes, the people have insulin. They're making insulin, but the body is not responding to it. In other words, they have insulin right there where they need it, but the cells are just not responding to it like they should.
So here we have your blood vessel, and as that blood is going through the blood vessel, it's carrying insulin, or the insulin's carrying along the whatever's needed to get into the cell, but it can't get in. Is that what you're saying?
That's right. There's plenty of sugar, there's plenty of insulin, but it's just not getting into the cell. The cells are not responding to that insulin.
Do those that are, I assume that they're at the Lifestyle Center of America, you are saying, look, for these types of individuals that are diabetics, they need to get back to simple foods as grown that are released slower into the bloodstream and whatnot, and this helps their diabetes. Is that right? You talk about the vegetarian diet?
Absolutely. You know, the genius of the vegetarian diet is that the plant foods, as they come from nature, are full of fiber, they're full of water, and they're relatively low in calories, especially the beans, the vegetables, the salad items, the grains. When you eat these foods, you can actually fill up and feel satisfied without getting too many calories. And part of the problem in diabetes is that we get too many calories coming into the body, and the cells start to fill up with this energy in the form of fat, typically. And the more of the energy that comes into the cells, the less the cell can bring in that energy. In other words, it starts to decrease its response to the insulin. But as you start to take on a diet where you're not taking in so many calories, a plant-based diet, you're actually starting to lose weight. The energy starts to decrease out of the storage compartment, so to speak, and the cells wake up and they start to respond to that insulin. and the blood sugar goes down.
Do vegetarians ever develop diabetes?
Well, this is an interesting idea, because we would think that if you're going to be a vegetarian, you wouldn't have any problem with diabetes. But in fact, when I was practicing in Iowa for a period of 3 years, I would see a number of different people who were vegetarians, and they still had problems with their blood sugar. We can still be on a rich diet and be a vegetarian.
Like what?
Well, what I mean by that is when we eat foods that are highly processed, highly refined, concentrated energy sources. For example,
Fake steak? Phony bologna?
well, you know, if you go into a grocery store
Okay.
and you look at the packages,
Right.
you know, a lot of these packages contain things like corn syrup, partially hydrogenated oils, enriched wheat flour. These are all foods that are plant in origin, they're vegetarian, but the fiber's been removed.
Okay, so they're refined.
And the water's been removed. And so they're concentrated, and they bring in more energy into the body than what was necessary, and so the weight starts to go up. And then diabetes can show up later on.
What about tofu? Is it a processed food?
Tofu is a processed food. And again, I'm not saying never eat tofu, but I'm saying we need to be careful. If our weight is starting to creep up, we might want to consider using foods in more unrefined and unprocessed state,
Even if we're vegetarians.
even if we're vegetarians.
Now, in diabetes then, as I understand it, the sugar goes up either because there's insulin resistance or because there's not any insulin made, like you've
That's
said.
right.
And what's the problem with the sugar going up? I mean, you know, what's the problem having a little more sugar around?
Well, one of the issues is that as your sugar begins to rise, it doesn't just stay there by itself. It begins to attach to other things in the blood. And one of the major constituents of the blood are proteins. And, you know, most of the major protein in the blood is albumin. That's one of them. Another major protein in the blood is hemoglobin. And hemoglobin is the protein, of course, that's carrying the oxygen out to the tissues. And it's very interesting that everyone has a certain amount of their hemoglobin protein that's attached to sugar.
I see.
About 3 to 5% of our hemoglobin is attached to a sugar. Now, there's a problem when sugar attaches to hemoglobin.
What's it do to it?
Well, actually, you can think of hemoglobin like a donut, or some have said like a bagel.
Okay. Don't want the sugar to go up. All
So
right.
we have this hemoglobin, it's
Right.
like a bagel.
Okay.
Well, hemoglobin actually attaches to oxygen very strongly. Now, the Creator has designed a chemical called DPG.
DPG.
DPG, diphosphoglycerate.
Okay.
Kind of a complicated name, but all it is, it's a substance that fits inside that bagel. And it's very important, because if it's not inside the middle of your hemoglobin, hemoglobin attaches to oxygen 20 times stronger
When that's there.
when it's not there.
When it's not there. Okay.
So its purpose is to fit in that hole so oxygen is released much more easily.
Oh, I see.
See, we need to get the oxygen out into the tissues, but we need DPG in there to allow that process to happen.
So the sugar doesn't allow it to be in there or something?
What happens is the sugar replaces the DPG.
Oh.
And so the hemoglobin holds on to the oxygen more strongly, and it doesn't get out to the tissues.
So in other words, diabetics usually, they'll develop problems where there's little tiny vessels, is that right? Like in their eyes or
That's right.
outlying areas?
That's right. The most delicate, fragile tissues, you start to see signs first. The retina of the eye, the very back of the eye, very delicate tissue, small blood vessels. And as more and more of your hemoglobin is tied up with sugar, you get less and less oxygen
and
to
that's
these
what
tissues.
causes the problem.
And that's one of the reasons. Now, one of the other proteins is albumin. And that's a major blood protein that can be tied up with sugar. So as we see the hemoglobin attaching to sugar, it becomes to create more and more of a problem. And that's why we measure something called hemoglobin A1C.
Hemoglobin A1C.
That's
okay.
the 3-month test that tells you what your blood sugar has been over the last 2 or 3 months. And all that is measuring how much of your hemoglobin is attached to sugar. And you want to get that down to about less than 6. That would be the best.
So at the Lifestyle Center of America, you take diabetics that have a problem, and what do you see happening to their hemoglobin, H1C, and these other things? In the 19-day program, for instance, what happens to them? Do they come there and they see this reverse? Is it reversible?
Actually, diabetes type 2 is a very exciting disease to treat because it is reversible. And we see all the time individuals come to the Lifestyle Center. For example, I have 2 patients right now. One individual came in on 100 units of insulin. Another individual came on 2 different oral medicines, medicines they take by mouth, for their diabetes. And their diabetes was not in good control when they came in.
In other words, their sugars were real high.
They weren't optimal.
Okay.
Now, one individual was better than the other. But as they got into a plant-based diet, an exercise program, and an entire lifestyle approach, what we're seeing is that both of these individuals are completely off of their medications, and yet their sugars are running very close to the normal range. And so the potential there is for individuals who have been on a lot of medications to actually be able to reduce their medications, and some individuals can actually come off their medications. But it requires a lifestyle approach in order to facilitate that.
So what I hear you saying is that sugar, I mean, lots of times when I would take care of people that had diabetes, they say, look, my doctor tells me I have sugar. And they called it exactly that. And, in my mind, I used to think, what is that? Is that like white stuff that we talk about being sugar, the brown sugar? What is that? What exactly is happening there? But what I hear you saying is that sugar itself is not bad in the sense of in the body. It's just bad if it stays too long in the bloodstream and doesn't get into the cells. Am I right about that? Tell me a little bit about sugar. Is it good? Is it bad? I know where it should be. It should not be, or where it should not be from what you've told me, and that's not in the bloodstream for too long.
Well, absolutely. Sugar is essential. In fact, our brain only uses sugar. And so that's a very important fuel.
How sweet it is.
The problem is that the Creator designed the system so that the sugar stays between a lower range and a higher range. And it doesn't get below that range or above that range.
So like the oil in your car.
Yeah, exactly.
Okay.
And so in diabetes, the sugar levels start to rise, and they're at a level that's too high. And so that starts to cause all of these other problems. Now we know that the sugar levels can actually damage the lining of the arteries and actually promote heart disease.
Well, how do you get the sugar then into the cells?
Well, what it actually takes, and what it's important to understand, is that all of the cells make these little doorways for the blood sugar to pass into the cell. And there are 2 tissues that we want to focus on in diabetes, and that is the muscle tissue and the fat tissue. They make these little proteins that are doors for sugar. And in diabetes, what happens is the insulin is made by the pancreas in type 2 diabetes, and the insulin comes along to the cell, and it signals the cell to bring those doors up to the surface.
So it knocks on and says, open up.
Right.
Okay.
And in a person without diabetes, the
cell
responds to that signal. The doorways go up to the surface, and the sugar goes in. See, when those doors are on the surface of the cell, the sugar goes in automatically. If they're there, the sugar goes in.
Okay.
So the problem is in diabetes that the signal is sent, the insulin is sent, and it tells the cell, bring the doors up,
and it doesn't happen.
And they don't come up. But as you start to reduce the energy that's stored in those cells, in other words, the excess fat, through an exercise program, through a plant-based diet, the cell starts to respond and it sends those doors up to the surface.
You are a Christian physician, and that means that you believe in the Lord, you believe in Christ, and you give Him the glory for what you do. And out of all the books you've studied, if you could recommend a textbook concerning diabetes, what would it be and why? The
best health textbook are the Scriptures. The Holy Bible is the very best. In fact, I would say it's the only health textbook that you really need.
So what does it say about diabetes?
Well, actually, it doesn't say anything specifically about diabetes per se, But if you will follow the guidelines in the Bible, and you don't have to read very far, the very first chapter and the 29th verse tells you the diet, the best diet for someone with diabetes. Fruits, whole grains, and nuts. Now, we want to talk a little bit later about what kind of fruits and how many for the person with diabetes. But whole grains and nuts and vegetables, which were added in the second chapter, are the ideal diet for someone who wants to improve their diabetes.
So fruits, nuts, grains, and vegetables. And that's why you're saying this is the best textbook, because it gives the plan that, is this the plan you use at the Lifestyle Center of America?
Absolutely. Now in the second chapter, verse 29 of Genesis, it tells us there what kind of an activity program that we were designed for. It says, in the sweat of your face shall you eat bread all the days of your life.
So you need to get out there and exercise.
In other words, we need an exercise level that causes us to sweat. That's the kind of exercise that will actually reduce the fat that's stored in your muscle, reduce the fat that's stored in your liver, and as these tissues lose fat, they become better able to absorb sugar out of the bloodstream, and your blood sugar drops.
We're talking with Dr. Tim Arnott. We're talking about diabetes. We've learned what it is. We've learned the type of problems that it causes. We learned that lots of people are suffering from these problems. And when we come back, we're going to talk more about the way to deal with diabetes. We're going to talk about how to apply some of the principles we've already learned from the most important textbook, that being the Scriptures. Join us when we come back.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Deal and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Deal and Dr. Ludington have been featured on 3ABM, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
We've been talking with Dr. Tim Arnott from the Lifestyle Center of America. We've been talking about diabetes, and it's been exciting to learn that diabetes is not something you just have to live with, especially type 2 diabetes. Isn't that right, Doctor?
Absolutely.
It can be stopped, reversed, and simply you were explaining that this can come as a result of just opening our Bibles and following the prescription that's given in the first 2 chapters of Genesis. Is that right?
That's correct.
Fruits, nuts, grains, and then you said vegetables. Well, I have a question for you. What is the connection between weight? You know, you say, well, you're overweight, so you're going to have diabetes. What's the connection between weight and diabetes, and how could the Creator's plan help us in this area?
You know, as we were talking earlier, what seems to actually be happening is as we are on a diet that's bringing in too many calories, those extra calories are stored as fat in the different tissues. They're stored in the muscle tissues. They're actually stored between the muscle cells. The extra fat is stored inside the muscle cells. In the liver, you can develop a fatty liver. So this excess fat is deposited in all the different tissues. And there seems to be a situation developing that when all of the storage areas start to fill up, the body basically seems to be saying, look, I'm full. I can't take in any more energy. And it starts to turn down the insulin sensitivity.
So when you get overweight, then it sends a signal to the insulin, and the insulin isn't as sensitive, or what happens?
The cells just seem to be turning off their ability to respond to insulin.
Okay.
The more the weight actually comes on to the body. And so but the good news is that as you lose weight, as you deplete these tissues, as you reduce the fat stored in these different tissues, then the insulin starts to work again.
Turns the switch back on.
Turns it back on.
Says we need your help.
Now, what's exciting about the Creator's program
fruits, nuts, grains, vegetables. That's what you're talking about.
Exactly. The ideal diet, the plant-based diet,
Right.
is that this is a diet that you can actually live with for the long haul. There are many programs out there, successful programs, to help people lose weight. I mean, one very successful program is a high-protein diet. I mean, people lose weight on a high-protein diet. People lose weight on a whole range of different programs out there for weight control.
Even amputation, probably.
But
that's probably not a good idea, right?
The problem with these is that you can't live with them forever.
That's for sure.
Because they have all kinds of side effects and problems associated with
I
them.
was just driving down the road the other day, and I saw this big billboard that said, you know, are you trying to live on a low carbohydrate diet? Here's a bread for you that can make this more easy. I mean, it's true. People
Yes.
are not making it, evidently, if there's billboards up.
Absolutely.
So yeah.
What's exciting and what is so fun to take care of individuals with diabetes is to have this program that the Creator offers that actually brings satiety. I mean, they actually feel full, maybe for the first time, because they're getting foods that are high in bulk, they're high in water, they're high in fiber. The plants were made to fill us up without filling us full of calories. And so we can actually feel satisfied and lose weight at the same time. That's what every person with diabetes.
And that's probably what you see there at the Lifestyle Center of America. Is this what happens as you teach them to cook and as they're eating there and with you? Do they say these kind of things? They feel full? They feel good?
Absolutely. People are astounded at their eating, and they thought they would be starving, and they're feeling completely satisfied, and they're losing weight at the same time.
Now, how important is it? Where should your blood sugar be? And you know, I've heard people talk about having it tightly controlled, or other people say, I'm a brittle diabetic. What's that all about?
We know there's two numbers that you want to remember. If you want to have tight blood sugar control,
okay,
then you want to remember two numbers. Now, why is it important to have tight blood sugar control? Well, now we know that if your blood sugar is out of control, in other words, if it's not tightly controlled, you start to have much more problems with blindness, for example, the disease of the eye called retinopathy,
okay,
injury to the kidneys, the nephropathy.
So all the little tiny vessels again.
That's right. All these different tissues start to suffer as the blood sugar goes up. So that's why tight control is very important.
So what are those two numbers we need to know? Or
Before every meal, your blood sugar should be less than 120.
before every meal?
Before any meal that you eat, it should be less than 120.
What about after?
2 hours after you stand up from that meal, any meal, it should be less than 140. So those are the two numbers that you want to remember. Less than 120 before any meal, less than 140 2 hours later.
So what if it's not happening? What food should you eat to bring it into tight control?
Well, the first thing you want to do is to get on a plant-based diet.
Okay.
Because this diet is the lowest in saturated fat. That's that fat that's at room temperature is solid. And that fat is particularly bad for someone with diabetes. Just makes the condition much worse. So a plant-based diet has the least amount of that kind of fat.
Okay.
So that's the first step. Get on a plant-based diet. Now the next thing you want to do is you want to get on a fiber-rich diet.
Okay, so these are the ones that can really help you keep it tight. Fiber-rich. And what do you mean by fiber-rich?
Well, what I'm saying is, you know, there's only really one source of removing fiber in our society that I can think of.
Processing
That's
food.
the food industry.
Okay.
So you want to get your food before it goes to the food industry, because they're the ones removing the fiber.
Go out in the field.
So you want to use whole grains.
Okay, whole grains.
You want to go to the bulk food section of your grocery store, buy those whole grains, and use all the different grains that are out there. There are 12, 15 different grains to bring a lot of variety. The beans are the richest in fiber. In fact, someone with type 2 diabetes, beans and whole grains are probably the very best entree for keeping the blood sugar
Why
low.
is it then that some vegetarians have problems controlling their sugar?
Well, you know, there are certain foods that somebody with type 2 diabetes has to be very careful with.
Like what?
Well,
As a vegetarian, like
for
what?
example, if you sit down to breakfast and you break open the cantaloupe or different melons. Those melons, for some reason, probably because they're lower in fiber than some of the other foods, such as apples, will raise the sugar through the roof.
Is that right? So cantaloupes, what about strawberries?
Strawberries are much better.
What about blueberries?
You know, the best foods
Okay.
in the fruit category for
All right.
someone with diabetes are what we call the northern fruits that grow up in Michigan, Washington. The apples,
Peaches?
peaches, pears, all the fruits with pits. Cherries.
Tomatoes? Some people say they're a fruit.
Actually, tomatoes are not the best for
Okay.
some with diabetes. I'm not saying never eat
So
them.
apples, pears, peaches,
And the pits, fruits with pits.
fruits with pits.
The
Okay.
plums, the peaches, the cherries.
And the others doesn't mean you can't ever have them, but you have to be very careful.
You have to be very careful. And again, you want to have your goals, your blood sugar goals. And so you want to be testing your blood sugar
I know where you are.
and know where you are. And if you're not meeting your goals, then you might want to use fewer of the melons and more of the apples.
We've got about a minute and a half left, and I want to ask you this question because you are a Christian physician and you referred to the most healing book that I know of, and we both agree on this being the Bible. Why would a Christian especially benefit from tight blood sugar control?
Well, of course, there are a number of benefits to tight blood sugar control. For example, if you're not getting the sugar into the cell, you're not feeding those cells. And so, for example, the brain isn't going to be fed properly as well. But you know, one of the most important complications of diabetes is heart disease. In fact, over half of the individuals, when they are first diagnosed with diabetes, already have coronary heart disease. In other words, they already have blockages in their arteries. And what we know now is that if you want to have total health, the very best health, you want to have the very best circulation of the blood through your arteries. So in order to protect yourself from further blockages of your arteries, you want to get that blood sugar down as low as possible.
So not only can it help your heart, but it can also help your head, and it can keep your mind clear, especially if you're a Christian, I guess anybody, but we want Christians to especially have clear minds as they're witnessing for the Lord. We've been talking with Dr. Tim Arnott. We've been talking about diabetes. We hope that you've learned some very helpful things. I certainly have. We hope you've taken some notes or contact 3ABN for more information. Thanks for joining us, and we hope that you have health that lasts for a lifetime.